Hello everybody, my name is Jay and I'm from Cryocord, the largest stem cell bank in Southeast Asia. Today I will be sharing about the general information of baby stem cells. Let's start off with the two types of stem cells that can be extracted from the mother's umbilical cord when you are delivering your baby. In fact, when you are delivering your baby, we can find a lot of good quality stem cells from your umbilical cord. Generally, stem cells are master cells that can turn into any type of cells in our body, including heart cells, skin cells, brain cells, hair cells, cartilage cells, and etc. Right? And at the same time, they are also multiplying very quickly, as in 1 becomes 2, 2 becomes 4, 4 becomes 8, and it goes on. So we are using these unique properties of stem cells to apply into medical field. For example, if an individual suffers from heart failure, we can actually inject stem cells into the heart region that is damaged. So what happens is that the stem cells can turn into the heart cells that we wanted, and then it will multiply inside to many more healthy heart cells to actually replace the damaged heart cells. So this is the general mechanism of stem cells. So let's jump into the first type of baby stem cell. So within the cord blood of the umbilical cord of the mother, we can extract cord blood. And cord blood contains a lot of hematopoietic stem cells, which is also known as HSCs. So HSC are the type of stem cells that can be turned into any type of blood-related cells in our body, including red blood cells, white blood cells, and also platelets. So they can be used to treat different kinds of blood disorders like leukemia, lymphoma, thalassemia, myeloma. I don't know why, but if you realize all the blood disorders, they actually rhymes. In fact, there are more than 80 types of blood-related disorders that are treatable using HSC. On the other hand, the water jelly of the umbilical cord contains the second type of stem cells, which is known as the mesenchymal stem cells or MSCs. MSCs are the stem cells that can be turned into any type of organ-related cells, except for blood-related cells. Like for example, heart cells, skin cells, brain cells, hair cells, and etc. Therefore, it is used to treat diseases that is related to organ damage, including stroke, heart failure, osteoarthritis, diabetes, spinal cord injury, brain injury, and it goes on. So very often many people ask me, who can use the baby stem cells for treatment? Generally speaking, not just the baby, but also the immediate family of the baby can use the stem cell for treatment purpose, but with certain matching rate. So let's talk about HSC first. The matching rate of HSC for the baby is going to be 100% because after all, it belongs to the baby. But for the parents of the baby, it's going to be 50%. As for the siblings of the baby, it's going to be 25%. But touch wood, if you miss out this opportunity to store your baby stem cells, and if you like to look out from someone who is not genetically related to you for a suitable stem cells, the matching rate is extremely low, and that is 1 in every 20 to 25,000, which is equivalent to 0.004%. Very, very low. But on the other hand, for MSC, it doesn't require matching at all for the immediate family of the baby. That means regardless it's the baby or baby siblings or parents or even the grandparents, like whoever wants to use the baby stem cells for treatment purpose, there's no risk of rejection. Basically, we are storing your baby stem cells in vapor phase liquid nitrogen, and that has a temperature of as low as -196 degrees Celsius. That is extremely low and extremely cold. So when stem cells are stored under that temperature, your stem cells actually undergoes hibernation. That means they'll sleep and sleep and sleep forever. Alright, there's no expiry date. So they can be stored for many years, even for decades or even for a century. And this is how stem cells are being stored in a stem cell bank until it is extracted for treatment purpose one day in the future. Touch wood lah. So to conclude, the list of diseases that is treatable by stem cells are increasing from time to time. Okay, for instance, recent studies have shown that stem cells are being very useful in treating some diseases like cerebral palsy and also autism. And like this year itself, guess what? Stem cells are being used to treat COVID-19 infected pneumonia, and results have been very positive. This means that the potential of stem cells are getting wider and wider from time to time because technology is advancing. So it is definitely one of the best investments to store your baby's stem cells while you're still pregnant for the health of your baby and also the entire family. Now I'll be sharing the general procedure of baby stem cell storage. First of all, if you're storing your baby stem cells, you need to have an op-gyn to help you to collect your baby stem cells immediately once you have delivered your baby. So for that, you need to select a specific op-gyn to attend your delivery. For those who are delivering in private hospital, or for those who have selected doctor in government hospital, congratulations, you have passed the first requirement of your baby's stem cell storage. Once you have enrolled with a stem cell bank, you'll be passed with 2 collection kits that looks like this. So your job is simple, just keep this safe at home, and when you're admitted to the hospital, just pass these kits to your doctor and your doctor will perform the medical procedure for you. There are 3 things that the doctor will collect for you. First is the cord blood from the umbilical cord once the baby is out. And that is the good source of HSCs. So this is done by poking a needle into the umbilical cord and allow the blood to flow into this collection bag by gravitational pull. Once the blood is collected, it will be inserted into the first kit. Secondly, the doctor will clean the entire length of the umbilical cord, which is a good source of MSCs, and then it will be inserted into one of these containers in the second kit. And the third thing that the doctor will collect is actually 10 ml of maternal blood. Why do we want to collect the maternal blood is because we want to have it tested against 6 different viral infections. That is hepatitis B, hepatitis C, HIV, HTLV, syphilis, and CMV. So touch wood, if the mother is tested positive for any of these viral infections, you are not allowed to store in any stem cell bank in entire Malaysia, as according to the regulations set by the Ministry of Health Malaysia. So mothers out there, if you are negative from any of these viral infections, congratulations, you have passed the second requirement of baby stem cell storage. Anyway, the entire medical procedure of collecting your baby stem cells only takes about 5 minutes, and it poses no risk to the mother and also to the baby. In fact, some mothers are worried that they will feel the pain when the doctor is collecting the stem cells for them. Worry not, you won't feel any pain because your umbilical cord doesn't contain a single nerve cell. Once everything is collected, the logistic team will actually head to the hospital and collect everything and send it back to our laboratory for processing. Once the stem cells have arrived at the laboratory, the HSC will be processed and the MSC will be processed and cultured to a greater amount before storage, subjected to CGMP certification, which is the current good manufacturing practice that is strictly required by the Ministry of Health Malaysia. And once everything is processed, it will be stored permanently in vapor phase liquid nitrogen. But it doesn't mean that your stem cells are okay for storage at this point. It needs to go through about a month of serology tests to make sure that it is free from any contamination from bacteria or fungus. If your stem cells pass this serology test, then congratulations, you have passed the final requirement of your baby's stem cell storage and you have successfully stored your baby's stem cell. Now I'll be talking about the treatments of baby stem cells. Like what I mentioned earlier, HSC from cord blood can be used to differentiate into any type of blood-related cells in our body. So they can be used to treat blood-related diseases like leukemia, lymphoma, thalassemia, myeloma, and it goes on. Recent studies, it is found that cord blood can not only treat blood-related diseases, but also some brain-related diseases like cerebral palsy and autism. Let's talk about cerebral palsy first. For those of you who don't know about cerebral palsy, it's actually quite prevalent in Malaysia. In fact, cerebral palsy occurs in 1 to 2 in every 2,000 babies born, and it is 10 times more frequent in babies who are born premature or in low birth weight. Usually it is caused by complication in delivery that causes a permanent damage in the brain of the baby. Symptoms may include stiffness of muscle, lacking of balance, and difficulty of swallowing. One of my first-hand experiences is that one of my friends had a child with cerebral palsy, unfortunately. As a result, the kid developed a few symptoms, like not being able to sit upright, where he's perpetually inclined to one side while he's sitting, and also he'll be holding up his fist perpetually. But fortunately, his parents kept his cord blood, and just 3 days after the injection of stem cells, we've seen very significant improvement, where he was able to sit upright and open up his fist. Now let's talk about autism spectrum disorder, or more commonly known as autism. This is also a very common disorder in Malaysia. In fact, 1 in every 160 children in Malaysia has autism. Many clinical trials of stem cell treatments on autism have been conducted worldwide, including Malaysia. But after the treatments of stem cells, we have seen very positive results from them, where they have less repetitive behavior, they are aware more of their surroundings, and also they can communicate and socialize better. This definitely gives new hope to the parents of the autistic children. On the other hand, for MSC, they are used to differentiate into any type of cells in our body, except for blood components. So they are used to treat organ damage related illnesses. For instance, heart failure, stroke, skin disease, osteoarthritis, spinal cord, brain injuries, and etc. Giving heart failure as my example, whenever there's a blockage in one of the main vessels in the heart, blood flow is cut and it causes a great damage to the surrounding heart cell. So even if the sufferer survives from the heart attack after performing surgeries like angioplasty or bypass surgery, the patient might still have a lot of complications afterwards. Like for example, they might still need to depend on wheelchair to move around. This is when MSCs play an important role, where in this case they are turned into heart cells and they will multiply and replace the damaged heart cells. And do bear in mind that nothing in this world can be used to replace the unique property of stem cells, where they are able to turn into any type of cells and also to multiply that quickly. Speaking of MSC's treatment, one of the most memorable treatments that I've encountered is actually a patient of mine with Parkinson's disease. So let's call him X. 2 years ago, X came to us wanting to know more about baby stem cell storage. And I got to know that he is actually a sufferer of Parkinson's disease for more than 9 years. He has tried a variety of treatments, but nothing has really helped much. So in 2019, he was 48 and his wife has delivered a daughter, and we have successfully helped them to collect and store their baby stem cells. In March 2019, we have had him in our treatment center and performed 2 stem cells injections on him on an interval of 3 months. Before the treatment, he had very obvious symptoms, like he would have tremors on his left hand and also left foot. And also he was unable to balance himself. Hence, when he was walking very, very slowly. But after the stem cell treatments, where he was no longer trembling and he was walking in a pace of a normal person. In this year itself, many countries like China, the United States, Canada, and also Israel, many clinical trials and treatments were done on patients with COVID-19 infected pneumonia, and results were very positive. Like what I will always say, the list of currently treatable diseases by stem cells will not be the same list in the future, because new diseases are emerging from time to time. And at the same time, stem cell technologies is also advancing from time to time. So the potential of stem cell is definitely getting wider and wider. And in fact, let's be honest, many of us only realize the importance of stem cells only when we actually need it. So my advice is this: while you're still pregnant, grab the chance to keep your baby's stem cells, because it's the only window to store it. Once you have missed this opportunity, it's gone forever.